What are worry and rumination in metacognitive therapy? Imagine your mind as a busy highway, constantly filled with cars of thoughts moving back and forth. Sometimes, traffic gets stuck in certain lanes, causing delays and frustration. That's similar to how worry and rumination work in our minds. They are repetitive thought patterns that can keep us stuck in negative feelings. But what exactly are these patterns, and how do they influence our mental health? Worry is a type of thinking that focuses on future threats or dangers. It often involves asking what-if questions like, what if I fail this exam? Or what if I get sick? Worry tends to be linked with anxiety because it's about potential problems that might happen later. It feels like trying to prepare for something bad that might or might not occur. Rumination, on the other hand, is thinking about past events over and over again. It's like replaying a mistake or a difficult situation in your mind, asking yourself why it happened or what you could have done differently. Rumination is often connected with feelings of sadness or depression because it keeps you focused on negative experiences and self-criticism. In metacognitive therapy, these thinking styles are seen as more than just symptoms. They are processes that can keep negative feelings going and make problems worse. The key idea is that it's not just what you think about that matters, but how you respond to those thoughts. For example, someone might believe that worrying helps them stay prepared or that ruminating helps them find solutions. But in reality, these strategies often trap them in a cycle of negative thinking. Metacognitive therapy introduces the idea of metacognitive beliefs, thoughts about thinking. These include beliefs like, I cannot control my worry, or if I stop worrying, something bad will happen. These beliefs can make worry and rumination worse because they create a sense of helplessness or urgency. When people believe they must worry or ruminate to stay safe or understand their problems, it keeps those patterns going. The therapy shifts focus from challenging the content of negative thoughts to changing how we relate to them. It teaches skills like noticing when worry or rumination start, then gently shifting attention away from those thoughts. Techniques like mindfulness or attention training are used to help people become more aware of their thinking patterns and respond differently. The goal is to help individuals develop more flexible control over their attention and see thoughts as mental events that don't need immediate action. Instead of trying to stop the thoughts, they learn to observe them without getting caught up. Over time, this reduces the power worry and rumination have over their mental state. In essence, worry and rumination in metacognitive therapy are habitual, repetitive thinking patterns sustained by unhelpful beliefs about thinking itself. The therapy aims to change those beliefs and responses, helping people feel less overwhelmed and more in control of their thoughts. This approach builds on traditional cognitive behavioral therapy but focuses more on how we think about our thoughts rather than just the thoughts themselves.